Welcome to SimBox. This simulation is intended to help you and your team practice your medical and teamwork skills by managing an acutely ill patient. We will start by playing the video and then we will do introductions. The format of today's session includes a 3-minute narrated pre-brief, followed by a 12-minute interactive simulation and a 15-minute case reflection and debrief. Pre-brief. The case will begin with a brief patient update, followed by a 2-minute countdown clock. During these 2 minutes, we ask you to assemble your team and assign roles. We suggest having a team leader and roles similar to your normal workflow. Examples include a person focusing on the management of the airway and a person who will obtain intravascular access or administer medications. After the 2-minute countdown, you will see pictures or a video of a patient, and vital signs will appear on the monitor. We encourage you to use cognitive aids and resources that you would normally use to manage an acutely ill patient in your environment. If you're participating in an in-person simulation, please use the equipment, supplies, and medications available to you. If you're participating remotely, please specifically verbalize your intended actions. At the end of the 10-minute case, you will be prompted to sign the patient out and transition to the debrief, where you will spend 15 minutes reflecting on the case. Some ground rules. We know that many aspects of the simulation will not be realistic. We ask that you do your best to suspend disbelief and act as you would in your role responding to a patient so that you get the most out of this experience. This simulation aims to challenge you and identify both successes and opportunities for improvement. Our basic assumption is that everyone here is intelligent, capable, cares about doing their best, and wants to improve patient care. Please keep what happens in the session today between us and do not share outside of this group. This is a safe space, and anything that happens during simulation today can be a learning opportunity that might make a great difference in patient care. If you want to bring up a technical issue, ask a clarifying question, or need a moment for a brief case huddle with the team, feel free to ask for a timeout, and we can pause the video and regroup. Introductions. Please share your name and role in patient care. How many years of experience do you have in that role? Is this your first time participating in a simulation? Now is also a good time to ask any questions you have. Let's begin. You will hear a brief patient update and see a 2-minute countdown clock as you prepare for the arrival of the patient. Assemble your team, assign roles, and obtain any equipment you need. ED, this is an ALS unit. We're coming in with a 4-month-old boy with respiratory distress. He has been sick for 4 days with cough, congestion, fever, decreased feeding and wet diapers, and difficulty breathing. He's breathing 80 times per minute. Oxygen saturations are 86% on room air, but increased to 99% on a non-rebreather. His heart rate is 170. We are working on getting a blood pressure right now. We will arrive in approximately 2 minutes. The patient has arrived. The infant continues to be tachypnic, working hard to breathe, and desaturates if we take off the non-rebreather. This concludes the simulation. Over the next 30 seconds, please hand off your patient to the receiving team. Thank you for participating in the simulation. Let's take a deep breath and take a moment to gather our thoughts. We will spend the last 15 minutes in case reflection. There are 4 steps. In step 1, we will share our initial reactions and feelings. In step 2, we will share a summary of the case and our medical management. Step 3 is analysis. What do we think went well? What could have been done differently? Finally, step 4 is summary. We will summarize the key learning points and we will go around the room and share one takeaway point that we might apply in our clinical practice. You will hear the narrated debrief prompts and discuss with your team. Click on the buttons on the screen to move to the next part of the debrief, or pause the video if you are using a downloaded version offline. Step 1. Reactions. Please share your initial reactions and feelings. How did it go? Step 2. Description. Would anybody like to share what happened with our patient? Please share a summary of the case and our management. Step 3. Analysis. What do you think went well? What could have been done differently? Step 4. Summary. Thank you so much for your input and participation. Would anybody like to summarize the key learning points from this discussion? After that, we can go around the room and share one takeaway point from the scenario that we might apply in our clinical practice. Thank you for participating in SimBox. We would love to hear your feedback. Please complete our participant survey scanning the QR code on the screen. Thank you.